is a short video to provide guidance on how to refer to community special care dental services and what information is required. Prior to making a referral, it is expected you would undertake a full dental assessment including radiographs to formulate a diagnosis. It is acknowledged that some patients will not allow full dental assessment and radiographs, but reasonable efforts should be made. A patient who is referred for an item of treatment or episode of care is still under your care during referral and whilst receiving treatment. You therefore have a duty of care to continue to manage them to stabilise decay and disease processes and provide urgent dental services for relief of pain. Please provide preventative advice in line with delivering better oral health. There is also helpful guidance in the Office of Chief Dental Officer Transition to Recovery SOP, which includes information on minimally invasive restorative techniques. In deciding if your patient requires onward referral to special care dental services, please review your local community dental services acceptance criteria, which you can find on their webpage. Referrals to special care dentistry are now made using the Rego platform. Please discuss with your patient their diagnosis and required dental care and gain agreement for this referral. Be clear that your local special care dental service will make the final decision regarding acceptance of the referral and any definitive treatment that is offered through their service. When referring via Rego, there are a number of box selections that will allow Rego software to assess if the referral meets the baseline criteria for a special care referral. This is the gateway for the referral. The provider service would also expect you to provide additional details in the notes section. When completing the medical section, please add the patient's medical conditions. If there is a particular medical condition or medication that means the referral meets acceptance criteria, please ensure it is added in this section. Further detail can be provided in the notes section. The notes section is your opportunity to ensure the provider service understands the reason this patient meets criteria for a special care dental referral. Comprehensive detail here will reduce delay in accepting the referral. It can be constructed similar to a referral letter. Please provide the following details: the main reason for the referral and the presenting complaint, the dental care required, the dental care you have already provided and any difficulties that were encountered, full details of any medical and mental health conditions including stability and medication list, details of any allergies, if their ability to communicate is impaired and any support that's required, details of any cognitive impairment, and state if you believe they are able to make decisions for themselves regarding their dental care. Can they transfer themselves to the dental chair, or do they need hoisting? Do they need home visits? Please note, if they are able to leave their house for any reason, for example a hair appointment, then they would not meet our criteria for home visits. If they require sedation, please explain your justification for this, what treatment you have already attempted, and what type of sedation you believe they require. Please include their modified dental anxiety score. Finally, if they are dependent on others due to a mental health issue or cognitive impairment, then please give the main carer's name, relationship to the patient, and contact details. Rego currently only allows you to refer for extractions or fillings. If there is any additional care you would like the patient assessed for, there are two options. The first is to elaborate further in the notes section. The second is to send an inquiry. This would include domiciliary referrals and referrals for examination in a patient who cannot cooperate for examination due to severe learning disability or challenging behaviour. If you believe they meet criteria for urgent access, please review your local provider's website for details. Criteria for urgent access varies between services, but in the main is limited to those patients who have a significant cooperation issue due to a learning disability, autism or challenging behaviour, and require sedation to assess, diagnose and provide initial management of an acute problem. In these situations, it is your responsibility to ensure that the provider service has the patient highlighted to them. In addition to referring via Rego, contact your local booking team either via telephone or email. In all cases, you must monitor the Rego website for any questions that may come back from the provider. The referral stays with the referrer until it is finally accepted. If the requests for information are not responded to promptly, the referral will be rejected. The referral will need to be resubmitted. Thank you for taking the time to listen.